My name is Dr. Kwatchey. I'm 69 years old. I'm a general practitioner working at the Atwa Government Hospital in the Lower Manya district of the Eastern region of Ghana.
My name is Mrs. Irina Ofei. I'm the Municipal Director of Health Services for Lower Manya Krobo. The records of the Ghana Health Service have shown that the prevalence of hypertension in Ghana is around 30%, so 1 in every 3 adults.
In 2014, we had over 300 new patients, and last year, that was 2015, we had about 500 new patients. So we are seeing a lot more cases, but there is still a substantial lack of awareness, and therefore patients aren't taking their hypertension as seriously as they should. And I think this is also partly because hypertension really doesn't have any peculiar symptoms. That is why it's known as the silent killer.
If a young person just falls dead, all of a sudden person collapses and dies, it is attributed rather to the witchcraft and other, but not to the hypertension. That probably is the hypertension or heart attack or maybe a stroke that has killed the patient.
My father actually, he had a stroke before it was discovered that he had hypertension. So that made me even more interested in hypertension, even while I was still in medical school.
The observation we have made that indeed the prevalence of hypertension is increasing. The OPD attendance is also increasing over the years. It is also increasing in younger population. So we see younger people with hypertension. And when you check the risk factors, they are obese, there is lack of physical activity, there is poor diet as well.
People think that when they come to hospital, they should be cured of their disease, like they will be cured of malaria or something. So when you tell them that they have to take the medicine for the rest of their lives, they are not very happy with it. And that's another major problem.
Sometimes we have patients who come for the drugs. Some of them too, because they will take the drug for some time, the blood pressure will come down, it will be normal, and they will think that, oh, I have achieved treatment, so I have been treated. They will stop, and then after weeks or so, they will be rushed to the health facility with the high blood pressure. With coming of the ComHIP, Community-Based Hypertension Improvement Project, we are able to address such issues because with ComHIP now we have trained our community-based volunteers. We also have community health officers or community health nurses who will also train on hypertension and how to do the screening for hypertension. And then we also have our CVD nurses, cardiovascular nurses. And then we work in collaboration with private partners. They are licensed chemical sellers.
Most people in the community, when they have a headache or a fever or something, they will go straight to the drugstore to buy some medicine. So the licensed chemical sellers have also been involved. They've been giving BP apparatus and things so that when anybody comes, they check. I think ComHIP is really going to change things because, as I said, patients, we are seeing a lot more patients who normally wouldn't have seen, because they just go to buy medicines and then they are discovered as having hypertension, and they are very happy about it. So I think it's going to change things. I think ultimately the way we are going to win the fight against hypertension is patient and public awareness, the kind of thing that ComHIP is doing now.